So today we are going to learn something about the vaginal stitch or the care to be taken during the vaginal after the vaginal stitch has been done. So after the childbirth, be it a C-section or be it a vaginal birth, there would be a small tear, an incision made, or naturally also this can happen irrespective of your gyna giving a cut over there as well. In C-section, the place of the stitches is completely different, but we are completely talking about the vaginal stitches and how to take care about it. So basically when such stitch is being done after the baby is out, they would stitch it up. So this can also lead to any sort of infection. So first and the foremost thing to avoid any sort of infection after this, make sure you are regularly visiting your gynac every 10 to 15 days once to cross check if your stitches are in place and everything is all right and there is no requirement of restitches and there is no sort of infections as well. So to avoid any sort of infection, firstly make sure that you are maintaining a good hygiene. Kindly avoid using any tampons or any of these things because this could also lead to a little amount of infection. So better to use sanitary pads. So this is so that it is simple and helpful for you at this point of time and comfortable too. And apart from this, make sure you are changing this sanitary pads at least once in every 3 hours duration period, and make sure you are wearing something light fitted clothes and you're not using any tight fitted clothes at this point of time. This is going to be at most helpful for you. And also there is, make sure that you are having a maintaining a good hygiene, because the chances of having an infection during this time is going to be little higher because you're going to have a heavy bleeding would be surely there after the birth. So make sure while you are changing the pads, every time you are washing your vagina with the lukewarm water and followed with any antiseptic solution, mild antiseptic solution suggested by your gynac, and followed with that again wash it with some simple lukewarm water again, and then you may try to remove any excess amount of moisture or water with the use of a tissue. So this can also be done at every time when you're going to change your sanitary pads. Apart from this, make sure you're drinking adequate amount of water as well as taking fiber rich food in the diet. So this is to avoid any sort of constipation, because if you are constipated, usually this is also one of the major concerns post pregnancy that women face. So if at all you have any sort of constipation issues, so you will tend to exert a lot of pressure on the stitches too. So this is not going to be in favor to us. So try to avoid this constipation issues, or try to get a mild laxative from your gynac at the time of discharge, just in case to take such things during the time of constipation if at all by mistake it just happens. Second important thing is, make sure that you are regularly visiting your doctor. Apart from this, ensure that you are avoiding any sort of intercourses at least until and unless the stitch is completely healed, and try to sit in a comfortable position. Do not exert too much of pressure on the vagina and the rectum. Apart from this, even the sleeping position could be something that is little comforting to you, so that at any point of day you're not exerting a lot of pressure on this. And try not to lift any heavy weights or do any sort of brisk walks or any sort of things that are going to actually add a lot of pressure on this place. So make sure you take utmost care during this period of time, because it is absolutely important to avoid any restitches, and which is going to be very painful. So let's better avoid it. I hope this video was helpful for the new mothers. Catch you on the next video. Until then, bye.